I'm going to walk you through the 3 exact steps that I use to help patients dissolve the calcium deposit, heal the tendon, and restore full movement all without surgery. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine physician currently practicing in the San Francisco Bay Area, and I've helped countless patients who were told there was nothing left to try to treat calcific tendonitis. Let's start with what calcific tendonitis actually is and why it happens. Calcium can build up inside a tendon when it fails to heal properly after repeated small injuries. This could be from chronic overuse, repetitive stress, microdamage. Instead of forming normal collagen fibers, some of the repair cells begin depositing calcium crystals within the tendon tissue. And this process most commonly affects the shoulder, but it can also occur around the hip, the elbow, or the knee. As those calcium deposits harden, they irritate the surrounding tissue and trigger inflammation. And that inflammation causes that deep, sharp pain when you move, or it makes sleeping uncomfortable. Physical therapy and specific exercises can improve mobility and strengthen the surrounding muscles, but in many cases, they don't actually break down the calcium itself. That deposit remains in place, continuing to irritate the tendon and cause recurring pain. So to truly resolve the problem, you need to break down the calcium deposit, stimulate proper tendon healing, and then rebuild its strength. And that's exactly what my 3-step approach is designed to do. The first step is to break up the calcium deposit, and there are 2 direct ways to do this. The first is called an ultrasound-guided needle barbotage and lavage. It's a minimally invasive procedure where a small needle is inserted directly into the calcium deposit under ultrasound guidance. Saline is then injected to loosen and fragment the calcium, which is flushed out through that same needle. This effectively removes much of that softened calcium, and it relieves the pressure and irritation inside the tendon. Research shows that ultrasound-guided barbotage can significantly reduce shoulder pain and improve function, often matching or exceeding corticosteroid injections, but with the key advantage of removing the calcium rather than just masking symptoms. The second option to break up the calcium deposit is an ultrasound-guided tenotomy, which is typically used for larger or more chronic calcium deposits. This quick in-office procedure uses a fine needle device to mechanically break apart the hardened calcium under precise ultrasound guidance. Disrupting the calcified tissue triggers a controlled inflammatory response that boosts local blood flow and releases growth factors to jumpstart the healing process. In other words, we're trying to clear out that damaged tissue and create the right environment for healing and regeneration. A meta-analysis that pooled data from 35 studies and over 1,600 patients found that ultrasound-guided tenotomy led to significant and long-lasting pain relief, improved tendon function, and very low complication rates. The best part of both of these procedures, the barbotage and lavage, as well as the ultrasound-guided percutaneous tenotomy, are that they are both performed entirely under local anesthetic, done in the office, takes less than 20 minutes, involve minimal downtime, and are typically covered by insurance, making them excellent alternatives to surgery for long-term pain relief and tendon healing. Now, the second step, once the calcium deposits are broken down, is to help the tendon actually heal. And that's where platelet-rich plasma, or PRP, comes in. PRP is made from a small sample of your own blood. We spin it in a centrifuge to concentrate the platelets, which contain powerful growth factors that regulate inflammation, stimulate collagen production, and recruit the cells responsible for tendon repair. Injecting PRP directly into the injured tendon after a tenotomy or after a barbotage gives the body a biological signal to rebuild strong, healthy tissue instead of a scar. It transforms the area we just cleared into a healing zone. A 2025 network meta-analysis reviewed 19 randomized controlled trials with over 1,100 patients who had calcific rotator cuff tendinopathy. PRP ranked highest in improving shoulder function and among the best for long-term pain relief, outperforming other treatments like corticosteroid injections, shockwave therapy, and barbotage. Because PRP uses your own cells, there's little to no side effects. When paired with either the barbotage or the ultrasound-guided tenotomy, it amplifies the body's regenerative response, turning a chronic degenerative process into one that can finally heal. The final step in this 3-step process is rehabilitation. Remember that the goal in treating calcific tendonitis is to stimulate healing of the tendon by first breaking up the calcium deposits and then using PRP to stimulate healing. Once new tendon fibers start forming, controlled loading of the tendon becomes essential. And skipping this phase is one of the main reasons people relapse or never fully recover. Rehabilitation begins with gentle range of motion to restore flexibility and reduce stiffness. After that, you then want to strengthen all the muscles that surround the joint that we just treated. The most important part is slow, consistent loading. It should be enough to stimulate healing without placing too much stress on the tendon. This phase allows collagen fibers to realign and remodel, which makes the tendon stronger and more resistant to future injury. Research consistently shows that structured exercise after procedures like tenotomies or PRP leads to much better long-term results compared with rest or anti-inflammatory medications. So when you put all three steps together, you break down the calcium, you repair the tendon, and build its strength back up, this approach treats the pain at its source, and it helps prevent all that pain and discomfort from coming back. If you want to learn about how PRP works and what to expect after treatment, watch my next video where I explain the full recovery process and how to get the best long-term results.